has always been there, but it will now be officially recognized in our allocations. As a result, our weekly allocation of first doses will increase from 75,000 per week to more than 82,000 per week, not counting that Pfizer reconciliation. Yesterday saw the launch of one of the new programs we announced last week, the Federal Retail Pharmacy Program. The Federal Retail Pharmacy Program is a collaboration between the federal government, states and territories, and 21 national pharmacy partners and independent pharmacy networks to increase access to COVID-19 vaccinations across the country. The program is coming online this week in Oregon. Shipments arrived on February 10th at 127 retail pharmacies across the state. This program offers locations in 27 of Oregon's 36 counties. These locations include 103 Safeway Albertsons locations, 13 Costco locations, and 11 Health Mart pharmacies, which are independent affiliates. The retail partners in this program will screen for the appropriate age band per Oregon's vaccine plan, starting with people 75 years of age and older. But we know we need to use these expanding supplies of doses effectively to keep up with growing demand of a larger eligible population and reach community immunity as quickly as possible. Let's go to the next slide, please. As this slide shows, beyond doses that go directly to retail pharmacies vaccinating residents and staff at long-term care facilities, there are 4 primary ways OHA distributes vaccines to our local partners. First, we use local public health authorities, who in turn work with local providers to get shots in arms. Second is mass vaccination clinics, such as the Oregon Convention Center and similar sites in Deschutes, Jackson, Lane, Benton, and Marion counties and elsewhere. High throughput sites that can handle a large number of patients, such as FQHCs. Fourth is targeted doses for specific high priority at-risk populations. For example, mobile clinics for homebound seniors or people with developmental disabilities. And finally, tribal health authorities, in recognition of our responsibilities to meet our government-to-government obligations to our sovereign tribes. In time, with adequate federal supply, we ultimately need to reach and maintain more than 25,000 doses per day to achieve community immunity in Oregon before autumn. Here are some of the steps we're taking to keep the pump primed, maintain high throughput, and prioritize vulnerable people and communities through these different vaccine distribution channels as we look forward to receiving more doses from the federal government. First, we're going to provide predictable allocations to vaccination sites. We want to provide vaccination sites with a consistent, reliable schedule of doses so they can plan multiple weeks ahead, which in turn would allow vaccination clinics the ability to open appointments on more than a weekly basis. Second, allocate doses to counties on a pro rata basis by senior population. We are allocating doses to county partners based on the number of older adults living in each county. Third, prioritize retail pharmacy distribution using the Centers for Disease Control and Prevention's COVID Community Vulnerability Index. We're directing the federal government to steer doses to retail pharmacies that serve census tracts with the highest social vulnerability, such as greater poverty, housing insecurity, and other factors. These are the communities most vulnerable to COVID-19. And finally, direct allocations to mass vaccination sites. We'll continue to allocate a sizable portion of our doses to centralized sites that administer vaccines to a large number of people per day. Now, let me turn it over to our partners. Let's start with Wendy Watson, Chief Operating Officer at Kaiser Permanente Northwest, and Dr. Mary Giswald, Associate Medical Director at Kaiser. They're going to talk about the vaccination clinic at the Oregon Convention Center and how seniors can get appointments in coming weeks.
Great, thanks, Pat. So I'll start with an overview of how we're doing with the 4Health system operation at the Oregon Convention Center. So we've been in operation for 18 days now, and over those 18 days, we have administered a little over 54,000 vaccinations. If we look at the breakdown of that, it's about 25,000 of those in 1A, a little over 26,000 educators, and 2,450 seniors age 80 plus that we started this week. We are working on continuously improving our processes at the Oregon Convention Center, and very grateful for the support that we're getting from the National Guard and other volunteer organizations. With that, we've been able to increase our daily throughput. We're currently operating at about 4,000 vaccines administered per day, and we have we'll be ramping up to about 6,000 per day as we start layering in second doses. So that's going well. We're also partnering very closely with our OHSU partners that's running the airport drive-through location. For the last 3 weekends, they've been focusing on the phase 1A and the disability community. and in that time have vaccinated over 16,000 in those categories. And they also are heavily relying on volunteers through the Red Cross and Port of Portland, for which they're greatly appreciative as well. I know weather is top of mind for everyone. We did unfortunately have to cancel at the Oregon Convention Center today and tomorrow. We wanted to make sure of the safety of those coming in to get vaccinated, as well as all of those who are working at the convention center as part of the vaccination site. We have 5,789 people who were scheduled today and tomorrow. We are proactively rescheduling all of those people into next week. And every one of those will be outreach to either through their My Health account, through email, or through phone call. So we are putting them onto a schedule and a date and time next week. And if that date and time doesn't work, we can reschedule, but we just wanted to make sure that everybody had a slot next week. That doesn't change anybody's appointment that's already scheduled for next week. Our hours next week will be 7 a.m. to 7 p.m., which is what we were previously planning. And then the Portland Airport site also canceled their operation this weekend and moved all of those appointments to next weekend. Looking at our future schedule release, we want to get to a very predictable, consistent schedule release where we can consistently be providing additional appointments. So we'll be moving to a schedule release on Monday and Thursday at 9 a.m. And each week we will release appointments at that time. The amount that we'll release starting on Monday is really up in the air right now, just because we have to wait and see how many reschedules we have to move into next week. Sunday is still a little questionable in terms of whether we'll be able to operate. Once we get through this weather event, then we'll be able to get into a regular release of appointments on those 2 dates. In terms of what we've released just recently, yesterday, we at 9 a.m. released 4,500 appointments at the convention center. And this is for the date of 2/19 through 2/23. And we also released 2,600 appointments for educators in wave 3. So those were released yesterday. Another area I'd like to cover briefly is just ensuring equity in reaching the vaccine. So we know the convention center and the Portland Airport sites are not the location for everyone. And so we are partnering very closely with the FQHCs and with local public health on the smaller, more targeted clinics that they're setting up, and really partnering across all of our sites to make sure that we're reaching everyone. In addition, the health systems are taking steps to make sure that our communities are also ready to receive the vaccine. And one example of that is Kaiser Permanente is awarding 2 $150,000 grants, one to the Oregon Latino Health Coalition and one to the Pacific Islander Coalition. And this is all around vaccine readiness and COVID-19 prevention. So our goal really is that no one is left behind as we work to vaccinate all Oregonians. So at this point, I'd like to turn it over to Dr. Mary Giswald.
Thank you, Wendy. I wanted to share briefly a little bit about how things are going clinically at the convention center. And I want to start by saying the COVID vaccine is safe and it is effective. And the benefits of the vaccine far outweigh the risks of getting COVID-19. So as Wendy said, we have vaccinated over 50,000 people so far at the convention center. And the number of reactions we are seeing are consistent with what has been reported by the CDC. We have protocols in place that are based on guidance from the CDC, and we have clinicians on site so that we're ready to respond to any clinical incidents that might occur. You know, true anaphylaxis after a COVID vaccination is a rare event. And recently the CDC released information reporting that they had seen 21 cases of true anaphylaxis in over 1.8 million people vaccinated. So really this is rare. You know, side effects do happen after the vaccine. Most commonly things like arm pain, fever, headache. These things happen in the first 48 hours after the vaccination and really are a sign that your immune system is responding to the vaccine and creating that immunity that you need. So, you know, at the convention center, if people have a history of allergic reactions, we do monitor them after their vaccination twice as long as we would someone who doesn't have a history of severe allergies. You know, I mean, getting COVID-19 is dangerous. I've seen patients die from COVID. I've seen friends get COVID who are young, healthy people. And the side effects are real and can linger for a long time after this disease. And people can suffer from this. So I just really encourage you that when it's your turn and when the vaccine is available to you, please feel confident that it is safe and effective, and it's the right thing to do for yourself, for your family, friends, and your loved ones. Thank you.
Thank you, Wendy and Dr. Giswold. Now let me turn it over to Dan Harmon from 211 Info. Dan will talk about how 211 Info and the Oregon National Guard have been working to answer questions from seniors and connect people to vaccination events. Dan?
Thank you, Pat. Good morning, everyone. Dan Herman. I'm the CEO at 211 Info, and I just wanted to provide some insight what it's looked like from the perspective of 211 Info. First point would be this has been all about rapid response. We knew that as we got started in this project in about 4 days' time, the ability to scale would be really challenged. And that's despite adding 10 to 20 staff each couple of weeks to join us. And that's also bringing in 2 subcontractor call centers to join us in the effort. Despite all that, we knew the risk. We made efforts with the goal towards helping Oregonians and pushing through the challenges that were there. Lo and behold, one of the wonderful things that happened here when you lean into a problem and look to solve that problem is from the governor's office, we got an opportunity to get 30 National Guard to join us. Over the past weekend, those National Guard either drove in or flew in to Portland, and Monday morning, we were training them. By Tuesday afternoon, they were on our call phone, they were on our telephone taking calls from 80 plus seniors and others inquiring about eligibility to get registered and signed up in the Get Vaccinated Oregon tool. Let me illustrate the impact that those Oregon National Guard had. The call load on February 2nd was over 1,500 calls a day. At times, 400 to 600 people were holding in the queue if they had not chosen our callback feature, which we strongly promoted. And call times were in some instances as high as 2 hours. Move forward after we brought the Guard on, again, effective Tuesday afternoon, to the statistics for February 11th, and we now had virtually no wait time. And that continues as I look at the queue this morning. Whether you call us or are waiting for a call back, you're going to hear from us within a matter of a minute or two. I think along the way, it's important to note, from my perspective, there was a couple very smart decisions made here. Obviously, number one was the enlisting of 30 Oregon National Guard to join in the effort. That decision came out of the governor's office last Thursday. Again, over the weekend, those folks arrived. The other really smart decision here is we're dealing with an audience, a group, a demographic that really is not oftentimes internet connected or digitally minded. So the ability to call 211, which is really a sweet spot, it's part of our value proposition, to talk human to human, person to person, proved really to be an important decision. Every week, we are getting kudos from communities, from callers. Our team is excited to help. There are a staff of helpers. And then lastly, I just can't praise the Guard enough. They're a fun group of people. They're outstanding in their effort and capabilities. And it's really been just a take the hill mentality, which has been so very helpful. Thank you.
Thanks, Dan. Our final guest is Stephen Serto, who's the Director of Pharmacy Operations for Oregon and Southern Washington for Safeway Albertsons. He's going to tell you about how Safeway and Albertsons will provide vaccinations at retail pharmacy outlets. Stephen?
Thanks, Patrick. I just want to start off by saying we, Safeway Albertsons, we're so grateful and appreciative of the partnership that we have with OHA. And we as a company, we're thrilled to be a part of it and be able to provide vaccines for the communities that we serve. So we are really excited. As Patrick said in his statement, we have 127 pharmacies in our Portland division, which includes South Washington. 122 of those are in phase 1 of the federal partnership, with 103 of them being in the state of Oregon. And we are excited to announce that as of this morning, we have doses and we have opened the scheduling tool, which I'll speak in a minute, and start providing doses at all our 103 in Oregon, 122 total facilities. And just so I can kind of understand and let people understand what's going on is all they have, if they're in the designated criteria for the vaccine, they can log on to our website either at www.albertsons.com or safeway.com, and it kind of sends them through a little bit of a couple questions, and then they can sign up for the vaccine. And what's the nice thing that we're appreciative is it's a pretty easy tool. We know that there are people in a certain age group that may not have internet access. They can actually call the store and work with the pharmacy teams to also schedule vaccines for them as well. But they basically just go through a set of questions, and the scheduling tool will automatically schedule them. We're open, vaccines are available Monday through Sunday. And then once they sign up for a scheduled time, the next day the tool will send them confirmation that they have an appointment. And what we're really excited about, the following day or day 2, the patient customer gets a confirmation of second dose. So the system automatically knows that we are giving Moderna, so they automatically have a appointment for second doses 28 days later. And then in the interim, depending on what they said on the website was their preferable means of communication, they can receive a phone call, email, or text messaging to remind them of the appointment. And just kind of give you a quick update, as of 9:30 this morning, we have almost 5,000 doses that are already on the scheduling tool of the total probably 12,200 that we have in all our 122 locations. So we're very, very excited to start this. As Patrick says, it's a slow process. Like I said, all of them are only receiving 100 doses. We do hope in the next couple of weeks to continue that. And as it ramps up, then we'll be able to open the scheduling tool a little bit wider so more patients can look 1 week and 2 week out. We just can't make that designation now because we're still not sure how many doses. But once that is available, we'll be able to open the tool weeks upon weeks so people can look and make sure. And then the last point I want to make, because it's very concerning from a consumer standpoint, is the scheduling tool also has the capability is that once all the doses are scheduled, it actually will shut itself down, so we don't have anybody that may get an appointment that really doesn't have an appointment for scheduled doses. So we're really excited about that. Again, we're excited to be a part of it and to do whatever we can to help our community. Back to you, Patrick.
Great, thanks, Stephen, and thanks to all of our guests for joining us this morning. Now let me turn things over to Dr. Seidlinger, who will talk about the COVID-19 situation overall in Oregon and the breakthrough cases we've detected.
Thank you, Director Allen. I want to start off today with an update on our pandemic here in Oregon. Over the past several weeks, we've seen a trend of declining daily cases of COVID-19. On January 2nd, our 7-day rolling average of new cases was 1,149. Yesterday, the average was 561, a nearly 50% drop. On Monday, we recorded 305 new and presumed cases, the lowest daily count since October 19th. Our latest weekly data report showed that for the week ending Sunday, February 7th, OHA recorded 4,049 new cases, the lowest total in 3 months. And these decreases are a testament to the actions all Oregonians are taking to slow the spread of COVID-19 and the sacrifices we've made. So thank you. As of today, we have reported 149,576 cases of COVID-19 in Oregon, including 517 new cases today. We've seen similar declines in COVID-19 hospitalizations from a peak of 584 on November 30th to just 209 individuals yesterday. COVID-19 associated deaths are also at the lowest total since mid-November. To date, there have been 2,094 COVID-19 related deaths in Oregon. Every death represents the loss of a loved one, a neighbor, and a member of our community. My thoughts go out to everyone who has experienced a loss. But now let's move on to some good news. Our percentage of positive tests has dropped to 4.2%. And this week, today, 12 counties in Oregon, including Multnomah, Washington, and Clackamas counties, received welcome news of a reduction in risk levels. These are encouraging developments, and they stand as a testament to the hard work Oregonians are doing to protect their families and their communities by wearing masks, limiting our indoor gatherings, and keeping physical distance. But make no mistake about it, the virus remains a threat to all of us. 27 of the state's 36 counties remain at extreme or high risk. Even with vaccinations increasing in Oregon, we can expect to see COVID-19 continue to spread throughout our state. And as more communities open activities, we anticipate that cases are likely to increase. We still must protect ourselves and our loved ones by wearing masks, limiting our indoor gatherings, and keeping our distance. We've already discovered that the more easily transmitted virus variant from the UK is present here in Oregon, and other variants may follow. As Director Allen mentioned earlier, OHA is beginning to receive reports of individuals who have tested positive after receiving COVID-19 vaccines. In public health practice, we call this breakthrough cases. These are people who get sick with COVID-19 at least 2 weeks after completing their vaccination series. As of today, we're reporting 4 of these cases, 2 in Yamhill and 2 in Lane County. The illness in these individuals has ranged from no symptoms at all to mild symptoms. And we're working with our local and federal public health partners to investigate the cases and determine their origin. Out of an abundance of caution, we will do genetic genome sequencing on the virus in these initial cases. We expect results next week. These breakthrough cases are not unexpected. No vaccine provides 100% protection, and clinical trials of both vaccines presently in use included breakthrough cases. In those cases, even though the participants got COVID, the vaccines reduced the severity of illness. And based on what we know about vaccines for other diseases, the data from clinical trials, experts believe that getting a COVID vaccine may also keep you from getting seriously ill, even if you do get sick. So what all this means is that we can expect to see more breakthrough cases. Getting as many Oregonians as possible vaccinated remains a critical objective to us in ending the pandemic here in Oregon. But there are also steps we can continue to take to prevent the virus from overwhelming us while we vaccinate Oregonians. Just this week, the CDC updated its guidance on face coverings to ensure they provide the best protection they can. These updates included making sure your mask fits snugly over your nose, mouth, and chin, checking for gaps by cupping your hands around the outside edges of your mask, wearing a mask with several layers, using a mask fitter or a nose wire for a tighter fit, and a cloth mask over a disposable mask can help ensure a better fit. I want to say that Oregon has avoided the fate of many other states suffering from the COVID-19 pandemic by adhering to our protective measures, and that's a tribute to each and every Oregonian. So thank you. Although still scarce, vaccines are becoming more widely available every day. More Oregonians are getting vaccinated by the day, and the existing vaccines offer unprecedented levels of effectiveness. The quickest and most direct route out of this pandemic is to get vaccinated when you're eligible. Thank you for your patience as you await your turn. Now I'll turn things back over to Director Allen.
Great, thanks, Dr. Seidlinger. Just one final point I'd like to make before we open up to questions. Back in the spring when we began reopening after a prolonged period of things being relatively closed down, we saw a significant increase in cases. I think because a lot of people thought we were going back to the way things were before the pandemic, and I think we all need to remember that period and remind ourselves that we're still not going back to the way things were before. We're going to need to continue to wear masks, to socially distance. Our businesses are not going to be able to, that are reopening, are not going to be able to reopen at full capacity. And those are all so important to continue to do and pay attention to while we move into this next phase and while we move through vaccinations. With that, Rob, I think we're ready to go ahead and take questions.
Okay, thank you. Thank you, Director Allen, Dr. Seidlinger, our guests. If you have a question, please chat the OHA host to get into the queue. Looks like our first question is from Amy Green at the Oregonian.
Hi, yes. This is for Dr. Seidlinger. Can you provide any more details at all about the breakthrough cases, how old these people were, how you said it was at least 2 weeks after they had received their second doses, I believe. How long? Can you give me a range of how long it is? And how was it that it came to be known that they were infected if they had, well, especially for the ones who had no symptoms?
Thank you, Amy. And I don't have the exact dates on how long it's been since their last vaccination or the ages. But what I can say is that these individuals were picked up because either they were tested because they had symptoms or tested for other reasons. And that none of these initial cases have been reported to us that have anything more than mild symptoms, requiring any of them to seek a higher level of care. The reason we use 14 days, and we stress that, is that that's what the studies have shown us, that the vaccines show their full effectiveness 2 days following full vaccination. So individuals we know can be exposed before their first dose, between their first or second dose, or shortly after their second dose, and may come down with symptoms before their vaccine has had a chance to have full effectiveness. And so those aren't the cases we count here. By waiting till 2 weeks after that second dose, we can be fairly sure that these were individuals who were exposed after they were vaccinated and likely got sick after that vaccine. But again, not to be unexpected in a vaccine that, while phenomenal with 95% effectiveness, still means that 5% of people may be infected. To date, we've had over 160,000 Oregonians receive their second dose. Not all of them are 2 weeks out from that dose, but that indicates a large number of people who could potentially develop disease after full vaccination. But again, the data we're seeing in Oregon, that other states are seeing, shows that we're not seeing severe disease or hospitalizations in these people. Our vaccination does work.
Just 2 follow-up questions. It's 2 in Yamhill, 2 in Lane County. Are they related to each other? Were they from the same households? Were they in the medical profession, perhaps? And then second question about transmissibility. Is this a reminder to people, even people who've been vaccinated, that they could be carrying the virus and spreading it, and so they do need to follow those safety measures like mask wearing and distancing?
Thank you, Amy. I do know that at least in one of those counties, these 2 are associated with a single location, so a cluster of cases. And that it is a reminder, as you say, that even when fully vaccinated, we need all Oregonians to take some steps to protect ourselves and our families and our loved ones. Masks are not going away anytime soon. So wearing our mask, continuing to limit our indoor gatherings, and keeping our physical distance from others, those are actions that are going to stay with us even as we get vaccinated. And those are steps you can take to protect yourselves right now.
Thank you.
Okay, right now we do not have anyone in the queue. So if you have a question, this is a good opportunity to chat the OHA host and identify yourself and ask your question. All right, looks like we have a question from Aaron Ross at OPB.
Hi, thanks, Rob. Dean, can you talk a little bit about what sorts of genomic surveillance you're doing around these cases?
Thank you, Aaron. So for these initial breakthrough cases, we're working to see if they had a PCR test that was performed, if we can obtain that specimen and get genomic sequencing on it to sequence the virus. If they have not, we're working to try and contact individuals so that we can get that sequence. While we don't anticipate that these are going to be associated with variants that are more highly transmissible, we want to be able to have that data. So we're working to get those from these initial cases. We'll work with our labs that are doing sequencing here in the state, as well as the CDC, to get that sequencing, and hope to have some initial results on that next week.
And has the presence of the South African variant in California, has that changed your outlook or raised any concerns?
I'm concerned about all of the more transmissible variants, particularly those that may be causing more severe disease arriving in Oregon. To date, under the current methods we're using to look for variants, whether that's through routine surveillance testing or trying to identify genetic kind of signs in some of our PCR testing to send some in to our wastewater surveillance that our partners at Oregon State University are doing, we have not identified either the South African variant or the variant from South America that was first identified in Brazil. It would not be surprising that we start to locate those as they are more transmissible, and we know that at least the Brazilian variant is, or that some of the variants are in our neighboring states. So we'll continue to look for those. But the good news is that the masks we're all wearing now, the actions we're taking to limit our indoor gatherings and to keep our distance work against not just what's circulating in Oregon right now, but against these more transmissible variants as well. And with the addition of some of the recommendations from the Centers for Disease Control and Prevention to look at how our masks are fitting, either by using a mask fitter, ensuring wire nose pieces, doubling up on masks if they're single layers, and other things to ensure fit. These are all great things we can do right now to protect ourselves from all variants of COVID-19.
Thank you.
Okay, next question is from Rachel Alexander at the Salem Reporter.
Hi, thank you. I'm wondering if you could go into a little more detail about how vaccine doses are being allocated to smaller and independent pharmacies, if that's a federal process or if OHA is playing a role there, and then how the equity piece you described about allocating doses to more vulnerable census tracts plays into that, if those doses are coming from the feds through that federal partnership.
Sure. So the federal partnership is with the three different groups that I identified: Safeway, Albertsons, Costco, and oh my gosh, I'm going to forget the name of the third group. I'm sorry.
Health Mart, isn't it?
Health Mart. Yes, that's right. Thank you, Health Mart. Health Mart is a chain, is an affiliated group of independent pharmacies with locations in places like Tillamook. Off the top of my head is a Health Mart pharmacy. They may have Health Mart in their name, or they may be branded as a local name, in their community. And they're getting their allocations. All three of those groups are getting their allocations directly from the federal government. Beginning with upcoming allocations, we're able to basically advise CDC on how to allocate those doses. And so, and particularly as the doses increase, what we want to do is to be able to identify pharmacies that serve census tracts that have a high community COVID vulnerability index, which is calculated and published by the CDC as an indicator of communities most at risk of not only incidence of COVID, but of negative outcomes of COVID. And so what we would do is try to send more doses to those pharmacies as we try to do a better job of reaching vulnerable populations that are at greater risk of contracting the disease, getting seriously ill, and potentially dying.
Okay, next question is from Ben Botkin at the Lund Report.
Variants. I was hoping that you could speak to any changes in testing protocols or infrastructure that are needed to test for variants, and if so, if those are needed, what plans are in place to prepare for that? Thank you.
Thank you for that question. I think what we'd like is more capacity to test variants, and that is coming online here in Oregon. The Oregon State Public Health Lab bringing on the ability to do sequencing in the coming month. What we have right now are several different processes. We have a process of general surveillance where we send a random assortment of samples in for testing to look for the variant. This is right now a small number of cases, but can give us an assortment across the state in various locations to look for this variant. What we know is that with the UK variant B117, is that on some of our tests that we do for PCR testing to look for the virus in clinical specimens, it gives a particular signature that indicates it might be a variant. So when we see that signature in that lab test, we send that on for sequencing. We ask our commercial labs to do that. The Oregon State, other labs that use this machine do that as well. And the subset of those samples, we found the B117 variant. In addition, if we see unusually large or quick spread of cases or an unusually large outbreak, we will send those samples in for sequencing to see if a more transmissible variant is playing into that. Our partners at Oregon State University are looking for viral fragments in wastewater and that can give an indication of looking for additional specimens collected from people in that waste watershed area for specimens. So right now, we have two of our academic partners, Oregon State University and Oregon Health and Science University, doing the sequencing with the ability to do it at University of Oregon as well, and coming on board our state public health lab partners, along with our federal partners at the CDC and various partners with our commercial labs. So again, we're building capacity and bringing that on board, and we have several different methods for identifying samples, either randomly or because of the circumstances, to test for that. Breakthrough cases are another example of that. If we see breakthrough cases, we sequence to see if it's the virus itself contributing to that, or if this is routine spread in a small subset of individuals who've been fully vaccinated who are still susceptible.
Okay, looks like we have a follow-up question from Aaron Ross at OPB.
Great, thank you. I was wondering if there's anywhere that people can access the list of available pharmacies, or how people will be notified if the pharmacies in their area are available to sign up.
That's a great question, and I might actually pitch that to Rob to see have we posted anything like that to our site. While he's go ahead.
To date, no, we have not. So the Google tool will link to a map of outlets for vaccination sites around the state. Our intent is to capture retail pharmacy outlets along with mass vaccination sites and other opportunities. But right now, we don't have that function built into the tool, but we are hopeful that we will have it shortly.
What plans are you making for non-phone accessible or non-web accessible folks?
Well, as Stephen indicated, people can simply call their local pharmacy. If they're their local Safeway Albertsons pharmacy, their local Costco, their local Health Mart, and if that pharmacy is not participating, I'm certain they can be directed to what's the nearest pharmacy in that organization that is.
Okay, thank you.
Mm-hmm.
If I could just step in, and Aaron, based on just our company, all the patient has to do is come in, and the first part is they put in their zip code, and it gives every single store, like I said, in a certain radius, whether it be 5, 10, 30, or 50. And then the stores, like Patrick and Rob were saying, have the ability for patients who can't or don't have access to the internet to call the pharmacy, and then they could either schedule it at that store or let them know what doses may be available at some of the surrounding stores and help them get scheduled that way as well.
Okay, our next question is from Kristen Whitall at the Lund Report.
Hi, can you hear me?
Yes.
Yep.
Okay, great. Yeah, the question I had, if you could, and this could be either for Director Allen or for Dr. Seidlinger, just talk a bit more about reaching community immunity. You mentioned 25,000 doses a day, I think, that you need to be administering to get there by autumn. Can you talk more about the pace of that? What percentage of immunity you're considering, community immunity, whether you might reach a certain point with vaccinations where you vaccinate everybody who wants to be vaccinated, and there's a big portion of the population that can't be bothered or doesn't want to be vaccinated, and anything else to do with reaching community immunity. Thanks.
Yeah, thanks. I'll let Dr. Seidlinger talk about the science of community immunity, which is still a little bit of a moving target with this vaccine. The 25,000 doses a day by autumn is based on sort of a standard notion of about 70% of the population needing to be vaccinated. That's more of a working number, I think, than a real number. The good news is we've already had several days in this rollout where we have vaccinated over at or near 25,000 people a day. And on those days, every single vaccinator was desperate to get more vaccine because they could have vaccinated more people than they did. So we've got ample capacity to reach that level and frankly beyond. But I'll let Dr. Seidlinger talk about the science of community immunity.
Thank you. I think, with this being a novel virus, we don't have a definitive number. We know this is a very virus that's easily transmitted from individuals, so we would expect to need a fair amount of people immune to the virus, likely in the 70 to 80% range at least, to provide that community protection. You asked about, when we reach that part and we have people, everyone who wanted to be vaccinated, but still a fair number of people who weren't vaccinated. And that hesitant population is certainly top of mind for us now. We want to work as we roll out the vaccine to provide messaging to individuals, to link them with trusted sources and appropriate information so that they can make an informed decision about getting a vaccine. We know that in some of our populations who've been overly impacted by this virus, there has been some reported increased hesitancy in getting the vaccine, some of our minority populations in the state. So we're working through partners and our local public health authorities to get information out to these populations. That work will continue as we roll out vaccine, and even when we have a fair number of the population vaccinated, to ensure that people have the appropriate information to make a decision about getting this vaccine, which, to reiterate, is a very safe and very effective vaccine. And we need to make sure that we get that information to individuals from a trusted source so that they can make that decision about getting vaccinated to protect themselves and their family.
Right now, we're in a circumstance where we're just real quick, we're dealing with the challenge of lots more people who want the vaccine than vaccine that we have. But we also know from our own surveys that about 40% of Oregonians say they for sure want to get the vaccine. About 40% think they probably do, and then there's a percentage that definitely don't want to. And there is a point that we're going to flip over from more people and not enough vaccine to needing to really work hard on getting into that second 40% and on up, and that's gonna become our challenges, getting people to be willing to get vaccinated, just like we do every year in flu season, where we could immunize a lot more people than typically step up. You had a follow-up?
Yeah, the follow-up question was just about children or young people, because the current vaccine is only good for older teens and above, I think. So what's the status on getting a vaccination for younger people, and how does that play into the 70 or 80% immunity?
Yeah, so my understanding is studies are now underway for kids down to age 12. And I believe that's both the Moderna and Pfizer vaccines that are doing that. Actually having the vaccine approved for kids will help with that immunity, because the 25,000 number really comes from 70% of all Oregonians, which in practical terms means you would need to vaccinate all adults, and that's really unlikely. So having kids, younger kids, eligible to be vaccinated will actually help us achieve that number.
Thank you.
Okay, we have a follow-up question from Ivy Green at the Oregonian.
Yeah, thank you. Again, for Dr. Seidlinger about the breakthrough cases, a couple questions. I'll just start off with the first two. Can you describe, in the time since I last asked you the question, I looked around a little bit, and I'm not seeing many national news stories at all about breakthrough cases. Can you describe how common this is? Do you know these 4 cases in Oregon, are they among many in the US that I'm apparently not seeing? Or is this, pretty much a new thing in the US? And are you reporting this to the CDC?
Thank you. I will say it would be a fairly new thing across the US using the definition that we're using. This is a definition proposed by the Centers for Disease Control that requires at least 2 weeks after the final dose. So really, most states are just seeing people who would fit that definition who could be considered a breakthrough case. And working and talking with our Centers for Disease Control and Prevention colleagues, they're finalizing up some of their details about their surveillance system and which details they'd like reported, but have encouraged states to begin reporting those cases onto the CDC, which we have. Right now, they do not have any plans to report the national numbers or numbers by state publicly. That's because different states differ in their reporting, in how kind of widespread their outreach efforts are with partners about reporting. With these cases being identified here in Oregon, we wanted to share this information with folks so they can see that we continue to monitor the situation of spread of COVID as well as vaccines. But again, this is not unexpected, and I would anticipate that more states will be reporting numbers of breakthrough cases as they have more people who are fully vaccinated and who, if they developed COVID-19, would meet the case definition as a breakthrough case.
Just to be clear, CDC is rolling out this reporting protocol as well as a case investigation protocol that they have just started rolling out, and Oregon is basically an early adopter of those case investigation standards and reports.
Okay, thank you. And then the last question, there was some CDC advice recently about people who've received 2 shots not needing to quarantine. What would you say to that in light of these 4 cases in Oregon? That they're pretty rare, and you would agree with that people don't need to quarantine if they've been exposed, if they've received 2 shots?
Yeah, I think in Oregon, our guidance aligns with the CDC guidance, and actually we came out with similar guidance in the weeks prior to the CDC. We know that with every vaccine, no vaccine is 100% effective at preventing disease, but the vaccines that we currently have in use and the vaccines that are in the pipeline for approval are highly effective. So the individuals who've received 2 doses of vaccine and have been at least 14 days out when they would be expected to have full immunity are not very likely to get the disease. And if they get the disease, it'll likely be mild symptoms. So we stand by the CDC and the OHA guidance that says that for those individuals who don't work in a sensitive location, like a healthcare setting or a congregate living facility or something else, where the spread of disease can happen much more quickly, that they could monitor their symptoms after exposure, but not have to quarantine in their house for 10 to 14 days if they've been fully vaccinated and it's been 2 weeks since their last dose.
Thanks again.
Okay, looks like there are no more questions in the queue. I know a lot of reporters are out covering the weather. I want to thank you all for joining us today. I want to thank our guests for joining us today and let you know we will be back next week unless, of course, we're preempted by a news conference with the governor. But other than that, I look forward to seeing you again next week. Thank you.
Thank you.